Curtis Ainsworth, and I'm the CEO of Remission Science. And basically what we do is we develop new medical technologies. This is our newest technology in the PEMF treatment field. It is state-of-the-art. It's what we believe is the finest machine in the world. I'm here with Dr. Torres, who's had a lot of experience with treating patients with PEMF, and he will tell you a little bit about the results that he has had. And here's Dr. Torres.
Hi, I'm Dr. John Torres. I've been a chiropractor for 22 years. I'm practicing in Connecticut, and I was introduced to the PEMF technology about 6 months ago, and I am very happy with the results that I've been seeing with my patients in treating a multitude of conditions. I've had shoulder injuries, I've had back pain, I've had cervical complaints from accidents, and we've seen amazing results with as little as several treatments. And the patients usually note a 50 to 75% improvement with range of motion, flexibility, pain relief within the first couple treatments. And usually after a series of treatments we can achieve 75 to 100% relief. The machine basically the treatment cycle is about 8 to 10 minutes, and 3 treatments a week is quite adequate in getting the results that we've achieved. Can you tell me a little bit about the capabilities of this PEMF8000?
Yeah, certainly. The main thing that we're focused on at Remission Science is continual development of this technology, and basically we are very concerned about the results and the performance of the unit for not only professionals but for people that actually have home treatments with the unit. We have made this unit to be extremely powerful and functional and affordable so that people can afford to have one in their home and professionals can afford it to have it at their practice. We believe that with some of the new features that we have on these units, which is very fine control of the pulse and power, that it is basically the best machine anyone can have.
Curtis, why would you consider this the best machine on the market for chiropractic offices, medical offices, or for home use?
Well, I'll tell you, I've been involved with energy medicine in various forms for over 10 years in research and development, and over that period of 10 years, the companies I've been involved with have put the most funds available, over $50 million, in research and development into energy medicine. And the result of that investment, we are actually bringing in improvements to this machine and new technologies that we're going to patent and introduce at later times. I would consider this to be state-of-the-art because we are doing continual modifications to durability testing. Right now our durability testing is up to over 2 years without any failures whatsoever in the components. So with our equipment, we're the first and only manufacturer to actually provide a lifetime service warranty with our equipment so that you can be confident that you have the best equipment available.
Is this machine difficult to use in a home setting? Does someone have to have extensive training or certification to utilize this?
Basically, the machines, the way that we've designed them with this type of system is one is to set up in your home, that you're able just to turn it basically on and off, increase and decrease the power slightly to your comfort level. If you're treating your torso, you can pull the power up a little bit, and if it's in a delicate area, like your face, our unit will almost go down to a pure stream power, very, very low and rapid pace, so that you can treat things such as wrinkles on your face, or you can treat other delicate areas that you can't with other equipment. On the other end spectrum, our unit is so powerful that you can never really use it at full power. You don't really need to. So we have everything covered from the torso to something, let's say that you're treating your face for difficulties with wrinkles, or your hearing, or different things of that type.
Curtis, what kind of attachments come with this machine that makes it such an outstanding machine?
Well, what we found in developing the outcome that people expect and the patients expect is we've come down to basically 3 different types of treatments available for this actual probe. We have a standard hoop, which is this size. We have another smaller hoop that we use for treating the prostate and other areas, which could be a small elbow. And we also have a double loop butterfly probe that we've just developed to improve its performance. And it's now being widely used from everything from depression to knees, joints, back, neck, and also for other issues that people have that are a little bit more difficult to get to. So we're confident right now that those 3 probes cover about 99% of everything that people need at a rapid pace.
What type of protocols or treatment scenarios would you recommend with this machine?
Well, what we have seen with this, Dr. Torres, is we've seen that basically treatment times vary from patient to patient. Younger patients seem to respond very quickly. We've had patients respond, teenagers respond within 5 to 10 minutes for various cramps and injuries to their, shoulders, neck, that type of ailment. When you have an older patient, the protocol is usually longer because they don't heal quite as fast as the younger patients do. At that point in time, we recommend treatment times of 20 to 30 minutes. And so it's depending on the reception that you get of the energy to the patient, and that relies mainly on the hydration of the patient and his conductivity, meaning how his body communicates pain and discomfort. And we find that if we hydrate a patient and provide him electrolytes a day or 2 before treatment, continually, that the response is very, very rapidly increased.
Are there any concerns about side effects, or can you get hurt if you don't use it properly?
Well, the history of PMF is such that there is no known negative side effects. It's technology that NASA uses in every space shuttle, space suit, and is essential to life. The people don't really realize how important pulse magnetics is, but without the Earth's magnetic field, that your survival rate is about 4 days. So pulse magnetics is essential to life itself.
Curtis, are there any contraindications or concerns for treating certain patients, limitations?
Yes, there are certain things that you have to avoid with patients, treating some patients, and that would be patients that have a pacemaker or defibrillator, any type of electronic pump in their system, like an insulin pump. Because the pulse electromagnetic fields affect those and can destroy the circuits, that you cannot treat people with those type of devices in their body.
It's like an MRI where you can't have anything magnetic.
Exactly, yes. If somebody has metal plates in their hip, knee, you can still treat the person. You may have to be a little bit further away from that area. But one thing about magnetic field, it's a non-directional, and it does have the cumulative effect of spreading throughout the whole body. So when you're treating a leg, it does travel throughout the body and cause positive effects throughout the whole body itself.
Now, PEMF technology has been around for 100 years. What advancements do you see in the future with your machine?
Well, I have a background in dealing with scientists in quantum physics, and basically what we're doing with PEMF technology today is we're taking it from the 1950s kind of mentality and applying some quantum physics principles to our units, which means that we are continually upgrading the performance, durability of the unit. Our components are very, very durable, and like I say, with the improvements that we're making on a continual basis, our units now have a life expectancy and serviceability before they have to be serviced of over 2 years. I would say the future of PEMF technology and affecting the cell, we're seeing extremely good results even from humans to equine, and at the present time, we're in development research with people like Tyler Surin at Santa Anita, who has the finest facilities in the world for treating horses, and he recently purchased 2 pieces of equipment from us to replace his equipment, and the results that we're getting at the racetrack are just phenomenal with equine. And we now have our units being recommended at the largest cancer center in the United States, and they are confident that this is the finest equipment they can find anywhere.
Curtis, is this technology available to the general public? Can someone purchase this for home use? Are there any restrictions as to who and where you can market this?
Well, what we're finding with the general public as they become more knowledgeable of science and the testimonials with PEMF, the largest growth that we see is in private parties having these at their homes or their exercise rooms to go ahead and have the healings right in their own home. Secondarily, I think that we see a lot of teaching physicians, we see a lot of chiropractors, physical therapists that are moving to this technology because it is vastly faster and more effective than what they can do with their own education and talents in their fields. I would say that we will see these units everywhere from football fields to inserted into automobiles, in the seats of automobiles, to large companies that want all their employees to have the benefits not only of exercise, but relieving things like carpal tunnel, relieving things like sitting in a chair and the back pain that they get for sitting in an office for many, many hours. And also, with the effects that we have for depression and relieving of tension, these units dramatically improve, an employee's productivity at work. So we see this in the workplace as being something that companies can offer as an extreme benefit and increase productivity of all their employees in their facility. And, we invite people to basically take control of their own future, know that they can do things at home that not even the finest physicians can do for them. And they will shortly find out that it's the best thing that they ever did for themselves and their families.
So this obviously, with its ability for pain relief, can eliminate the need for all that Tylenol, the Motrin, all the pain pills that people take to treat the #1 complaint that people have today, and that's back pain.
Yeah, and we see relief. It's my opinion, we see most of the relief in back pain, fatigue, metabolism. We've seen instances of dramatic weight loss. We've seen instances of various very positive things. When you start to put positive energy in your body, you see things getting better. And it's not specific to one situation that you have. It's based on the cell's response to being replenished with energy. And replenishing that energy makes you stronger, makes your cells stronger, and you find a myriad of different benefits in performance and athletics to recovery from old age circumstances and problems you might have just due to the natural process of aging.
Excellent. Well, now you've heard it. The capabilities of this PEMF8000 sounds like an amazing machine. We're seeing tremendous results, and thank you very much for all the
Thank you, Dr.
information.
Torres. Thank you very
Pleasure.
much.